How much does RPLND surgery cost? If you're facing testicular cancer and considering a retroperitoneal lymph node dissection, you might wonder about the cost of the surgery. The price can vary quite a bit depending on where you are and how the procedure is done. Typically, an open RPLND surgery costs around $7,100 to $7,200. This approach involves a larger incision and is usually less expensive because it requires less specialized equipment. On the other hand, laparoscopic RPLND, which uses small incisions and cameras, tends to be slightly more costly, averaging about $7,800. This is mainly because of the advanced equipment needed and longer operating room time. However, laparoscopic surgery often allows for a shorter hospital stay, which can help reduce overall costs. If the surgery takes less time and you leave the hospital sooner, the total expenses might balance out or even be lower in some cases. Several factors influence the final cost. The surgical approach is a big one. Open surgery is generally less expensive than laparoscopic by about $600 to $700. But if the laparoscopic procedure is quicker and you recover faster, it might save money overall. The length of your hospital stay also matters. Shorter stays mean less hospital billing, and minimally invasive techniques often help patients go home sooner. Equipment costs and how long the surgery takes are also important. More complex equipment and longer surgeries increase the price. It's worth noting that these costs are just for the surgery itself. Additional expenses like anesthesia, preoperative tests, post-operative care, and any other treatments such as chemotherapy are not included in this estimate. In the context of testicular cancer, RPLND is a common surgical option, especially for certain stages of nonseminomatous germ cell tumors. It involves removing lymph nodes from the area behind the abdomen to treat or help stage the cancer. When possible, surgeons perform nerve-sparing techniques to help preserve fertility and ejaculation. While specific cost data for RPLND and other reproductive cancers like cervical cancer is not usually reported, this surgery is mainly used for testicular cancer because of how the disease spreads through lymphatic pathways. If you are considering RPLND, it's very important to speak with your healthcare team and insurance provider. They can give you a more precise estimate based on your individual case, your location, and your insurance coverage. In summary, expect to pay roughly $7,000 to $8,000 for the procedure itself. Remember, costs can vary based on the surgical method, operative time, and hospital stay. Always consult your medical team for personalized information and guidance.